as we know, immigrant population makes up a very large portion of the healthcare workforce, and they fulfill many critical gaps that we have. If you look at just some of the forecasting that is coming out in terms of the gap that we have in the healthcare industry workforce, we're seeing that by 2030, there's going to be a shortage of, over 100,000 physicians alone. When we look at bringing outbreaks, to an end, trying to detect cases or exotic diseases, it's very difficult. But when you have individuals from diverse backgrounds with diverse experience, they're able to leverage a lot of that, knowledge and help us in those kind of onesie twosie cases that may be, a needle in a haystack, and they bring a lot of that experience here to the United States. And in the COVID-19 pandemic, when we were moving from conventional capacity to contingency to crisis capacity in our standards of care, everything from PPE to providing care and trying to make makeshift equipment and supplies, because there was obviously a big issue with supply chain. We were actually leveraging experience from a lot of our colleagues from around the world to figure out how do you do this in a resource-rich environment, but because we have lack of supplies, how do you do this? And so we were able to utilize a lot of their expertise in that way as well. So they bring in this brain bank, if you will, that we're able to utilize in a lot of these situations.
Clearly, we have tremendous needs for talented people in healthcare at every level. We don't have enough medical practitioners in many fields. Immigrant physicians are among the few who are willing to take positions that generally graduates from the US don't desire to take. The vaccine of Pfizer and Moderna is based on the work done by an immigrant from Hungary. So she is one example of how immigrants contribute to healthcare at many different levels. If you look at the founders of biotechnology companies or technology companies in general, the contribution of immigrants is amazing. So we cannot afford to lose this talent.
But I dream that one day we could reimagine all the degrees, qualifications, the barriers we put together that prevent people from actually being able to move forward. And I see this in different ways. In New York State, just to use lab technologists, it's so restrictive that people from New Jersey can't come and work here. And so you don't want to be in a hospital without a lab technologist. We have qualified people who can cross the state lines. We have qualified people cross, borders, and we're not doing that. And instead, hospitals are short. We're not able to always do all the things the way we should do them because we've really shot ourselves in the foot. So I would imagine reimagining that whole state. I do wish that people would recognize talented people in just that way. And, Dr. Vilcek talked about some of what his foundation has done even for autism. Well, the same stigma appears in many different ways when people are interviewing others and differences come into play. I wish that we get to a place where there's representation, the diversity within organizations that matter enough where we're not having this conversation anymore. And in order to do that, we need enough diversity in and across at executive seats and throughout, Congress, all of these places that we're looking at. We're not going to be able to change outcomes if we don't change representation.
I have gone, like many other immigrants, through an interesting, exciting, and also, I would say, challenging at some time. I had to leave things that I made possible for more than 20 years. I had an MD and a master in public health, but I was not master in finding a job, because that was totally a whole set of skills, and especially specific to US, because it's a bit different than in other places. In the beginning, when I came, I immediately bought the USMLE books, and I said, okay, now I want to get recertified and be a physician again. And within a few months, 6 months to 8 months, I noticed that it was not going anywhere, because the whole finding a job and board certification and everything might take another 3 to 5 years. But I had to support my family. The bills did not wait for a month. I had to work and make a living. And at that time, I made the decision that, okay, maybe since I have worked for Ministry of Health and with the UN for some time, I'm maybe not in a clinic and hospital setting, maybe public health will be a good alternative. Somebody I met, connect me with Upwardly Global, and they helped me with resume, cover letter, LinkedIn profile. I did not have a LinkedIn profile before coming to US, and I made a LinkedIn profile and went to many of the networking events and putting all the pieces together, and I eventually landed a job.